Hi everyone, my name is Christine Bangalin and this is my head to toe examination. I have a patient with me, his name is Victor. He's a 36-year-old male here for a wellness exam. Prior to me coming into this room or the examination room, I've already had my medical assistant check his vital signs, completed his hearing and his vision test, which was all within normal limits. Today I'm going to go ahead and start off by introducing myself. I've already washed my hands in front of my patients. So Victor, what brings you in today?
I'm here for a wellness exam.
Okay, and anything else that's bothering you today?
No.
No, okay, so you're just here for your annual physical then?
Yes.
Okay, so as I introduce myself, I'm assessing my patient's cognition, that he's dressed appropriately, his hygiene and grooming is good. I'm gonna start off with his face and his skin. There's no abnormalities of his face. His face is symmetrical, no abnormal lesions or abnormal nevus. And I can go ahead and assess for his hygiene. I can also check for infestations in his hair and make sure I can palpate for any abnormal nodules or any abnormal nevus also in his head. Next up, I'm going to go ahead and check for his trigeminal nerve. I'm going to palpate his masseter here. Go ahead and open your mouth and move your jaw side to side. And I hear no clicking and it's all normal. Any tenderness here?
No.
No. Okay, great. And then go ahead and for next up, I'm going to assess his cranial nerve 7, which is his facial nerves. Go ahead and smile for me, Victor. It's symmetrical. And go ahead and puff up your cheeks. I'm going to let the air out just to make sure it's normal and everything looks good. Next, we're going to inspect his eyes. I have a visual of his eyes. Both of his eyelashes on the top go up and both go on the bottom, and again, they're symmetrical. So I'm going to go ahead and palpate his lacrimal ducts, make sure that there's no drainage or any palpable nodules. Any tenderness there, Victor?
No.
Okay, and then I'm going to check his conjunctiva. They're pink and moist, no abnormal colors or redness. Next up, we're going to go ahead and assess the pupils. Make sure that his pupils are reactive. And I can also see a corneal reflex, and they're accommodating as they're constricting as the light passes through. Up next, we're going to make sure that we check his fields of gaze, cranial nerves 3, 4, 6. Go ahead and follow my finger, Victor. I'm going to go in a star pattern. And we're going to make sure that his eyes are able to follow where my fingers are going. So it looks like Victor's eyes are all normal, no abnormalities there. Next up is the cover and uncover test. Go ahead and cover your left eye. All right, and go ahead and put it back on your lap and go ahead and look at me. And I make sure that there's no wandering of his eyes. And go ahead on the next eye, cover this eye, and go ahead and put it back down. And his eyes are able to maintain direction towards me. Next up, we're going to move over to the fundoscopic exam. The fundoscopic exam is going to allow me to get a visual of the patient's eye vessels or vessels in his eyes, whether or not they're normal or have any nicking. And I also am able to get a visual of his optic disc to see if there's any abnormalities there. I'm going to go ahead and examine his right eye against my right eye, but of course you do this on both sides. Right here I see the red reflex. I have a visual of the vessels and there's no nicking, and his optic disc is also intact, and there's no cupping. Next up is inspecting my patient's ears. We want to make sure that the pinna is lined up with the outer canthus of the eyes, and both is symmetrical. We want to make sure that there's no tenderness. Any tenderness there, Victor?
No.
Right, okay. And we're gonna get a visual of the ear canal. For an adult, we're gonna go out and up just to get a visual, and we're gonna make sure that we get a visual of the ear canal. Okay, and then I have a visual of the tympanic membrane, and it's pearly gray, and the cone of light is at 5 o'clock. Next up is inspecting my patient's nose. We see that his nose is midline and is symmetrical. I'm going to go ahead and palpate the bridge of his nose. Any tenderness there, Victor?
No.
Okay. And I'm going to go ahead and palpate his sinuses. Any tenderness here?
No.
Okay. And any tenderness there?
No.
And you haven't been sick in a while, right?
Mm-hmm.
All right. And I'd also like to get a visual of his nasal mucosa. I'm going to go ahead and get a visual. Go ahead and stick it back. All right, and his nasal mucosa is pink, no drainage, is pink and moist. And I also will do the other side. And his nasal turbulence is in there, and it's midline, no swelling. And Victor, did you have any issues with your smell?
No.
No. And go ahead and close one nostril and breathe in. Okay, and the other side. And both his nostrils are patent. Next up, we're going to go ahead and discuss the mouth and the oropharynx. His lips are symmetrical, they're clean, there's no abnormal lesions. I'm going to ask the patient to open his mouth. Go ahead and say ah. And then put your tongue over the roof of your mouth. And I'm going to check for the floor of his mouth. There's no abnormalities. Go ahead and say ah. Awesome. His soft palate is pink and moist. His hard palate is fused. There's no bad odor coming from his mouth. And his tonsils are midline and no enlargement. And additionally, and obviously, my patient and I have been talking throughout this interview, and I can see that his cranial nerve 12 hypoglossal nerves are intact and no abnormalities there. So next up is inspecting the neck. So the skin around the neck is also normal. It's dry, it's warm, no abnormalities that I can see. It's also important to visualize the trachea, which is also midline. Next up is I'm going to palpate his lymph nodes to make sure that there's no tenderness or any nodules that I can feel for. We're going to start pre-auricular. Any tenderness there?
No.
Post-auricular, post-cervical, anterior cervical, submandibular, and just let me know if there's any tenderness, and submental, as well as supraclavicular. While we're here in this space, we're going to assess for the patient's vessels and make sure to see if there's any pulsations or over pulsations that we can visualize. I don't see that, but I can go ahead and palpate his carotid artery. I can feel the pulse right here, as well as right there. And I can also go ahead and auscultate to make sure that there is no bruise. I don't have a bell on this stethoscope, but I'll go ahead and take a listen anyhow. And no bruise. We're going to go ahead and make sure that his spinal accessory muscles are also intact. So go ahead and shrug for me, Victor, okay? And I'll go ahead and go against my hand here. There you go. And on the other side. All right. So for this one, we're going to go ahead and make sure that we can palpate the thyroid, but Normally, we don't palpate the thyroid in-house, it's normal not to, but for the purpose of the head to toe exam, I'm gonna go ahead and rest my both hands on his clavicle and get a feel of where his thyroid is, just about right here. Go ahead and swallow for me. Any tenderness there, Victor?
No.
And then I did not feel any abnormal nodules or enlargement, and it's normal. Up next, we're gonna go ahead and assess my patient's upper extremities. We already have a visual of his clavicle, as well as his shoulders, and they're all symmetric and none is uneven. And I also have a visual of his scapula from right behind here, and there's no nodules or any abnormalities that I can feel. While I'm on this side, I can go ahead and make sure I can palpate his acromion process in his joints and ask whether or not he's having any tenderness anywhere. And as I move down, I can go ahead and get a visual of all of his fingernails, that there's no discoloration or abnormalities. And I can also check for cap refill, which is brisk and is at 2. And while I'm holding his hand, I guess I can check for grip strength. Go ahead and squeeze, and they're both equal. Additionally, I wanted to make sure I also check the range of motion of my patient's shoulder. Go ahead and do this for me, Victor, and let me know if there's any pain or tenderness anywhere.
No.
And we could go ahead and switch out on the other hand.
No.
And so the range of motion of his shoulders is also intact with no pain. And another way to do that is go ahead and moving your hands laterally this way. And you could go ahead and hyperextend, no pain there.
No.
Okay. And then it's also easy to make sure that we have range of motion in the elbows. Any pain there, Victor?
No.
And then while we're here, we can also rotate the wrist. Any pain or tenderness anywhere?
No.
Wonderful. So it's also important to make sure that we check for deep tendon reflexes as we check for the upper extremities. Right here we have the tricep tendon, the brachioradialis tendon, and the bicep tendon, and we want to make sure that we isolate each tendon, and there should be some sort of flexion that is elicited when I strike each tendon. So go ahead and just relax. Just relax and rest. And I'm just going to go ahead and strike it just above the elbow. And then this is bicep tendon. Okay. And then just right there. Perfect. So up next, we're going to do the posterior chest and back. This allows us to assess the patient's lungs. I'm looking for any abnormalities within the skin, any scar tissue, any discoloration, and we're looking at the AP diameter, whether it should be 2 to 1. It looks like his back is also symmetric, and he is not engaging in any respiratory distress, and he is engaging in unlabored breathing. So I want to make sure that I auscultate his lung sounds, which I'll do now, and just take a deep breath every time my stethoscope touches your back. Okay. Now every time my stethoscope touches your back, you can also go ahead and say 99 so I can check for vocal fremitus.
99. 99. 99. 99. 99. 99.
And you should be hearing some muffling. And we're gonna go ahead and check for tactile fremitus, and you're gonna say 99.
99. 99. 99. 99. 99.
And so the vibration on this should be decreasing as you make your way down. Next, we're going to go ahead and auscultate. And it should be resonant throughout. Okay. Lastly, we want to make sure that his lungs are expanding equally. Go ahead and take a deep breath for me, Victor. Okay. One more more time. And we want to make sure that our hands part as my patient takes a deep breath, and that's normal. So we've already finished assessing his posterior chest. We're going to go ahead and move over to the anterior chest. Like any of our other assessments, we want to make sure we get a visual of his chest, of his skin color, any discolorations, tattoos, any abnormalities really. Since we finished with the posterior side, I just want to make sure that I finish off auscultating his lungs on the anterior side. And go ahead and just take deep breaths. And his lung sounds are clear. Since I already have my stethoscope on, I want to also make sure that I can listen to his heart sounds using ape to man. We want to make sure that S1 and S2 are present and that there's no other murmurs and extra heart sounds. So we're going to go from ape to man, which is aortic, pulmonary, urge point, tricuspid, and mitral valve. And afterwards, we're going to go ahead and make sure that we can also palpate the apical point. I'm just listening to your heart sounds. Just breathe normally. And since Victor is not a heavy set individual, we can also try to palpate for the PMI or the apical point. And sometimes it's also normal not to be able to palpate it. So we're going to also make sure that we can listen to his heart sounds laying down in the same process as he was sitting down. We'll go ape to man. Make sure that all his heart sounds are normal and that there's no murmurs. We can hear S1, S2, and that there are no extra heart sounds. Again, we're going to go from ape to man. And it's a normal exam. All right. So up next is going to be assessing the patient's abdomen. Again, it's important to check for shape, symmetry, get a visual of if there are any abnormalities, any deformities and such. And it looks like we have a normal examination of the abdomen. And of course, if we were in clinic, patient's abdomen would also be exposed. For the abdomen, we want to make sure that we auscultate first. We're going to auscultate for bowel sounds in all 4 quadrants, and we're going to use the diaphragm of the stethoscope. This is his umbilicus, and his bowel sounds are present. And of course, I don't have a bell, but with the bell of the stethoscope, we're going to check for vascular sounds. So this is the aortic, renal, iliac, and femoral. And of course there's no bruits, and that we want to make sure that there's no abnormal bowel sounds. So after auscultating, we're going to go ahead and move over to palpating the abdomen. So this entire abdomen, I want to be able to percuss it all throughout, and we're going to go on a downward and upward motion, and we'll do that throughout. And a normal finding would be tympany. And we'll do that all throughout, and it looks like we have normal findings with that. Next up, I want to be able to percuss for the spleen. We're going to move over to the left side of this patient's body and find the 6th intercostal space. And that's just about right here. I'm going to ask Victor to go ahead and breathe for me. Breathe. And we should also hear tympany. If there's any dullness, that can indicate that the spleen is a little bit enlarged. And next up, we're gonna go ahead and percuss for the liver. We're gonna do top down and then bottom up. And we're gonna also make sure and this is his umbilicus, and we're gonna start bottom up. And wherever his liver is, it starts to become resonant, and that's just about right here, and that's his liver. Okay. After percussing, we're gonna make sure that we're able to palpate in the same notion that we percussed. So we're gonna go ahead and palpate all throughout his abdomen to make sure that there's no nodules or any abnormalities that we can find, and we're gonna ask the patient if he's feeling any pain. Any tenderness anywhere, Victor?
No.
Make sure it's soft and there's no hardened areas. Okay. And then we can also palpate his spleen, and it's a deep palpation here too, in the same way. And sometimes it's okay not to be able to palpate the spleen. If you can palpate it, it means maybe that the spleen is enlarged. And also, Victor, for the liver, we're gonna ask the patient to take a deep breath so I can hook my fingers into his ribs here. And go ahead, Victor. So this is his ribs right here. Go ahead. Okay, and I can palpate it just a little bit, and if it's a little over, it means that it might be enlarged, and it can indicate cirrhosis of the liver. Lastly, I forgot to mention earlier, as I palpated the patient's abdomen all throughout, I wanted to make sure that we touch base on the McBurney's point for rebound tenderness to check for appendicitis. So where we want to go from 2/3 into his iliac crest into the umbilicus, and that's just about here. Any pain there, Victor?
No.
All right, next up is the hips. So Victor is laying down already, and then I want to make sure that I assess any pain here.
No.
Okay. And then while we're in this position, we can also assess for passive range of motion. Go ahead and lift your leg up, and then back down. And then I'm gonna take your knee outward, and then go up. Okay. And of course we do that on both sides.
Next up is the lower extremities. I want to make sure I have a full inspection of the skin on the lower extremities. Make sure that there's no deformities, any discoloration, or any other abnormalities such as swelling or redness. And I want to make sure I can palpate the knee. Any tenderness here, Victor?
No.
Okay. And then I'll go down his ankles. And of course you do this on both sides. Any tenderness here, Victor?
No.
Okay. And you can feel me grabbing onto your foot, right?
Yes.
And we want to make sure that the patient has sensation on both legs, just to make sure that patient does not have any neuropathy. All right, and nothing there. And while we're here, we can also check for cap refill. Next up, we want to make sure that we have a range of motion, or assess the patient's range of motion on the knees and the ankles. Go ahead and extend both your knees out, Victor. And if he was standing, he can hyperextend it in the back posteriorly. And go ahead and rotate your ankles, and then point your toes towards your face. Okay, and that looks like he has normal range of motion on both the knees and the ankles. Up next is making sure that we also make sure we assess for deep tendon reflexes. We are going to isolate the patellar tendon. There should be a light flexion. And then we'll also check the Achilles tendon, and there should also be a light flexion. Just go ahead and relax. There should be a light. And then my patient is also ticklish, and we can check for the Babinski reflex. Great. Part of the neurological exam, I also have to assess the patient's gait. So Victor is able to stand upright with no assistance, and that looks good. I'm going to ask you to walk towards the hallway, Victor. And when you walk back to me, walk on your tippy toes. Okay, no pain or anything?
No.
Okay, and on the way to the hallway, walk on your heels. Okay, and on the way back to me, just heel toe, heel toe, heel toe. Okay, alright. Okay, while I have you standing up, we're going to assess for the Romberg test. It looks like Victor is standing with no assistance, so that's also normal. I'm going to ask you to put your hands out like this. Go ahead and close your eyes. And there is no swaying there, so that means that we have a normal Romberg test. An important part of the neurological exam is also testing for sensation. And there's different types of sensations that we need to test for. There's interoceptive sensation, which is synonymous with superficial sensation. And with this particular test, we want to make sure that Victor is able to distinguish and tell me whether or not he's feeling pain. And I can show you by using the pointed end of this barbecue stick and the duller end of this barbecue stick. So Victor, when I place this on your arms, you're going to tell me whether or not it's painful.
Yes.
Louder.
Yes. Yes.
And if I add any more pressure, of course, Victor is going to tell me that his pain is more severe than the previous pokes. Additionally, we want to make sure that his senses are intact and he's able to sense temperature, whether or not to distinguish between hot and cold. So is my hand warm or is it cold?
Warm.
And what about this tuning fork?
Cold.
And then we'll do that bilaterally to make sure that he's able to distinguish hot and cold. Next up is proprioception, which is synonymous with deep sensation. We can and proprioception is able to determine position, sense, and awareness. For this particular demonstration, we want to make sure that Victor is able to determine whether or not the tuning fork is, or when the tuning fork stops vibrating as I activate it at the base of his toe. Again, we'll do this demonstration bilaterally to determine if there's a difference between the left and the right in terms of sensation. So I'm going to go ahead and activate this tuning fork, Victor, and at the base of your right toe, you're going to tell me when the tuning fork stops.
Okay. Stop.
Okay.
Stop.
Okay. So that means his senses are intact, and both of them, both his left toe and right toe, have the ability to sense when the tuning fork has stopped. Lastly is the cortical sensation, which is a combination of both deep sensation and superficial sensation, which allows us to process the stimulation and how we're able to perceive the stimulation. For stereognosis, I'm going to place an unidentified item in Victor's hand, and by his personal experience and his sensation on his hand, he's going to guess what I have put in his hand. Go ahead and close your eyes, Victor.
Cotton ball.
Okay, that's cotton ball. And how about this one?
Doggy bag.
Okay, that is a doggy bag. Up next, we have what's called graphesthesia. Graphesthesia, Victor is able to tell me, I'm going to ask Victor whether or not he's able to tell me what letter I've written on the palm of his hand. Of course, we do that bilaterally as well. Go ahead and close your eyes. And what letter is that?
Oh.
Oh, wonderful. And in terms of the 2-point distinction, I'm just going to go ahead and explain that. I want to make sure that I'm able to determine whether or not Victor is able to determine, is this 2 points?
Yes.
What about this?
2. 2. 2. 2.
And eventually, as we get closer and closer in the distance, he'll just feel one stimulation, and that's a 2-point distinction. And lastly, extinction. We check bilateral for both bilaterally in sensations, and if he closes his eyes, he's able to tell me where the stimulus is coming from.
Both.
Okay.
Left.
Okay.
Left. Both.
Both cheeks?
Both cheeks.
Okay.
Left leg. Right leg.
And if he has heightened sensation or lower sensation on either side of his body, we have to check that to make sure that he has no brain lesions, or it could be determinant of brain lesions.
Alright, so up next is the spine. We're going to go ahead and get a visual of the spine. It looks like it's straight, or the curvature of his spine is normal as he's standing up. Victor, I'm going to ask you to go ahead and put both hands up and act like you're diving. On the way down, I'm running my fingers down his spine, and it looks like he has a smooth curvature of the spine and no swaying. Go ahead and stand up. We're going to keep the hips straightened out, And I'm gonna have you turn towards me on the left side. Any pain there?
No.
Okay, and we'll do the other side. Okay, and go ahead and raise both hands again, and we're gonna hyperextend. All right, any pain there?
No.
All right, thank you. So it looks like the range of motion of his spine is intact.